Hello and welcome to this video on lupus. As per Dr. House, it is never lupus.
I don't think this is lupus.
So, it's infection, lupus, drugs, or cancer.
No, I think lupus is way more.
And yet, somehow, lupus is always a proposed diagnosis when every other obvious option has been exhausted. So why is that the case? It comes down to what lupus is and the symptoms that it carries. A lupus is an autoimmune disease, in short a disease where the immune system attacks the body or does something stupid. Technically it's known as systemic lupus erythematosus, although that is far too long, so we'll simply call it lupus. The stupid in this case is not just by the patient's own volition wherein they lie, but instead tissues within the body are attacked. The problem is that all tissues can and generally are attacked at the same general time by the immune system. The immune system is meant to deal with various foreign elements like pathogens or internal threats like cancer. And because it's attacking your own body, it makes identifying both the first symptom and cause very hard. And since not all symptoms show up in an obvious manner, external to the actual event, in the order in which they occur, you don't necessarily know if, in the case of House at least, that treatment has not caused it, or if it's a progressive symptom that's occurred after others, or if it has occurred much earlier and you're only identifying the symptom long after it has occurred. The common symptoms include painful and swollen joints, fever, chest pain, hair loss, mouth ulcers, swollen lymph nodes, feeling tired, a red rash, and all sorts of other diverse symptoms. And this is the problem. These extremely diverse range of symptoms can be either misdiagnosed as lupus, or alternatively other conditions may be diagnosed instead of lupus. So you can either diagnose lupus incorrectly as being the cause, or misdiagnosing lupus and instead attribute something else as the cause. And this is why the differential diagnoses of Dr. House always includes lupus. Lupus covers most of the common symptoms shown, and pretty much every symptom of the initial conditions that are presented in every episode, at least initially. Lupus is not necessarily an acquired disease either for that matter. It is largely not caused by any external pathogen like a virus or bacterium. Instead, it is mostly down to genetics. However, there are ways to trigger lupus through drugs, just be aware of that. Some drugs can cause it, which is a real problem. It's also possible to develop something called non-systemic forms of lupus. First we'll look at the genetics, as this is the vast majority of lupus cases. The key here is because it is the vast majority, and humans being humans, there are different genes that are responsible, and there are a number that have been related to the development of lupus, but it seems to be that you need multiple genes to trigger it. Generally speaking, the triggering will occur due to an environmental factor, but the key here is that you need to have the underlying genetics for it. Genes include a range of receptors, a range of kinases, and more. All of these, and to be clear, there are quite a few, either individually or collectively increase the risk of developing it. About 1/3 to 2/3 of all genes appear to be heritable, and that's important, particularly when they're looking at twin studies. Twins found that the susceptibility for heritable genes sits at about 35%, whereas family genetics alone account for about 66% of the rate. So you have a much worse chance if you have a family history of lupus. But at the same time, you also have a pretty high chance of developing the mutation spontaneously, which is just as bad. It's exactly the same problem, it's just slightly less likely. Just remember, even if you carry one of the genes, it's unlikely to lead to development of lupus, and that's for a simple reason. Lupus is generally considered to be an allogenic trait. The allogenic trait requires multiple genes to all be present for it to take effect. Then we have drug interactions, and this is one of the more common reasons why you may see in the episodes of House, lupus is proposed. A drug interaction lupus is more accurately called drug-induced lupus erythematosus. The upside to this is that, unlike genetic-based lupus, it is reversible. you stop giving the person the drug, which should stop it from happening. Fortunately, pretty much all the drugs that do this are known, and there's 38 medications that are currently on the list of possibly able to induce lupus, which is why when they are being administered, you will be monitored very carefully. After all, you don't want to cause another disease in somebody when they already have something wrong with them. It makes it really hard to treat them, and it's why the differential diagnoses in-house always end up bringing in lupus, because they've started giving the individual drugs, and suddenly, oh, we have lupus symptoms. Yeah, you may have caused it. That doesn't actually mean they have lupus. Finally, there's the non-systemic form of lupus. This is pretty much limited to just the skin, and, well, diagnosis is thankfully rather straightforward. It's a biopsy. And the only major worry with this, because it can be managed, is that, well, a local or a discoid lupus is able to progress to systemic lupus, which is really bad, because then it goes from being basically a skin rash to being your whole body's under attack. The mechanism by which it works is pretty much the same as for any other autoimmune disease, thankfully, in that respect, and that is the body's immune system does three things. One, it has to recognize that something in the self body, that is your own normally occurring cells that are otherwise being no problem whatsoever, are suddenly foreign, basically misidentifying self cells as non-self cells. Then, those aspects or antigens of those cells that are being targeted get antibodies being made against them. Those antibodies then facilitate the other cells within your immune system to begin attacking these self cells, and therefore you have both the antibodies, which generate inflammatory responses in part, and the cells responsible for attacking the body. In some respects, you could think of it as being similar to asthma, in that a relatively small and benign trigger that shouldn't cause any trouble has now been recognized as the immune system as being a bigger threat than it really is, and so the body begins to try and deal with it every time it comes across it. In the case of asthma, this is that small and benign and innocuous trigger causing inflammation of the air passageways and, to a certain extent, suffocation. In the case of lupus, it's a similar hypersensitive response, but the hypersensitive response can be to any number of different triggers that all cause the same misassociated response, targeting parts of your body that shouldn't be targeted. In order for that to happen, though, unlike asthma, which is another form of autoimmune disease where you have a hypersensitive response alone, this has a series of other failures attached to it other than the hypersensitivity. The failures are in the B cells themselves, which are what make your antibodies, and in the T cells that are meant to monitor and regulate those B cells and prevent self-targeting antibodies from being generated. The various genetic traits that are, let's say, either missing or mutated within individuals that develop lupus are in the B cells related to the CD27 genes, and in the T cells they're related to the co-stimulation and gene transcription within the various splicing of that genome. There are also issues to do with the various cytokines or cell signals around inflammation, things like interleukins or interferons that cause some of the therapeutic targets that are the B and T cells to be activated. In this case, they're elevated incorrectly. The key here is that because they're elevated, they send a signal telling the B and T cells to proliferate. And the important thing with their proliferation is that that happens in order to respond to new threats that the body has not encountered before. Or in this case, unfortunately, they proliferate in response to a threat the body has encountered before, because the body is itself. Because of that, the control and proper regulation of those cells and removing of those that will attack the body isn't conducted correctly. And because there is a greater rate of this self-attacking expression, you end up trying to deal with them, and that increases cell death in the form of apoptosis. But not all of them die, and then because not enough of them die, more and more of them become able to get through the checks. And this is one reason why lupus will gradually get worse over time if not treated. Diagnosing it is, for the most part, fairly straightforward, and it's generally done through anti-nuclear antibodies. Basically, is there an antibody to self cells? And that's the general first-line test. And if that anti-nuclear antibody test comes up negative, the disease, or lupus in this case, is ruled out. If you take someone's skin, which is what the biopsy is for, and you use immunofluorescence, you're able to cause the antibodies within the serum that should be taken at the same time to bind to the skin biopsy, and using that, you're then able to see whether or not, through fluorescence, if those antibodies are binding to the biopsy sample. That tells you immediately if the body is recognizing itself as a threat somehow. There is a certain criteria when you are testing this and certain other, let's say, methods, but the problem is there's no standardized clinical method. To be clear about it, there is a diagnostic criteria, but that diagnostic criteria was never intended for, clinical practice. It's from the American College of Rheumatology, and it was intended primarily for use in scientific research. Basically rheumatology, but, within a laboratory, and generally speaking with mice. Most doctors get frowned upon if they start considering their patients as mice, so although the following criteria can be used, just be aware that it is, let's say, not as specifically developed for the purposes as you might hope. The first criteria is the malar rash, and that's what you get your rash on your cheeks from. Sensitivity and specificity are issues there. If the sensitivity is greater than 57% and the specificity is greater than 96%, it's an indicator that yes. There's the discoid rash, which is the rash on your face, scalp, and ears. Sensitivity for this is much lower at 18%, but specificity is much higher at 99%. There is serososis, which is inflammation of the membrane around the lungs. Essentially, one of the bigger concerns, mostly because breathing's kind of important. The sensitivity for this and specificity are both relatively low at 56 and 86% respectively. You'll also find that there are oral ulcers, arthritis, photosensitivity, blood testing, renal problems, and anti-nuclear antibody testing. You can also use immunological disorder positive anti-Smith antibodies, which is a rather more difficult test, mostly because it requires all sorts of extra material. And then finally, there's neurological disorders, which, to be frank, if you get to the point where the 11th criteria has to be considered, the condition has progressed much further than is going to be good for anybody. A less specific, but still useful criteria that may indicate that lupus has occurred or is going to be diagnosed is a fever over 37.7 degrees Celsius or 100 freedom units, extreme fatigue, hair loss, and fingers that are turning white or blue due to hypoxia. This is also known as Raynaud's syndrome. When it comes to treating lupus, you're really managing it rather than treating it. And that's because there is no cure. You want to try and minimize the number of times in which lupus will flare up or occur, and you want to make those flare-ups or recurrences as short and as low level as possible. The reason for this is that the longer they go on and the more severe the flare-up is, the more extreme subsequent flare-ups will become, because the body has developed a stronger response memory. Basically, the body goes, we've dealt with this, but it was a major threat last time, make sure we have more preparations for next time. One of the treatments you can use is corticosteroids. These work fairly straightforward because they help to some extent in suppressing the immune system, basically lowering the ability of the immune system to respond so aggressively the next time. You can also use anti-malarial drugs, although these are generally not used as much. You both try not to use corticosteroids because alongside suppressing the immune system for lupus, they suppress it overall. And anti-malarial drugs carry a range of side effects. In both cases, beyond the rather obvious problems you'll find, there's associated conditions like lupus nephritis, that is, because of the lupus damaging so many parts of the body, it can cause your nephrites, or the functional unit of your kidney, to become damaged, leading to what is, for all intents and purposes, a kidney disease, which is bad, in case you weren't aware. Unusually, this is also one of the few conditions in which we can actually agree with crazy people that hydroxychloroquine has use. Unlike COVID-19, hydroxychloroquine actually works for lupus, and even better, hydroxychloroquine's been approved to treat lupus. Admittedly, the approval was way back in 1955, so the strenuous testing of it at that time wasn't anywhere near what we have today. The challenge with lupus, as mentioned, is that it's not necessarily a treatment that makes the disease go away. Rather, you manage the flare-ups and the consequential severity increases. And that's the problem with it. Over time, the frequency, duration, and severity of those flare-ups will increase, meaning that over time, patients will increasingly need greater healthcare, and given that, at least in places like America, where House is based, healthcare involves, selling blood, kidneys, children to the tuna factory, all sorts of places you can't realistically afford to keep being cared for unless you have really good health insurance. For the rest of the world, whilst yes, it is an increase in the healthcare burden, it's a manageable healthcare burden, as thankfully lupus is not that common. In terms of, the rest of the world, from the 1950s or thereabouts, those with lupus would survive, if they were lucky, 5 years. Today, more than 90% will live for more than 10 years, and the majority of those individuals will live pretty much the standard duration of life, and that's because mortality rates have gone down. Admittedly, quality of life has not necessarily improved significantly after 1955, but even if it hasn't improved significantly, not dying is always a bonus. And this is why it is never lupus, except when it is.
Apparently, he has one more symptom. His body's making an extra antibody, type B. Combine that with his natural type A, and presto changeo, he magically pulls blood type AB out of his hat.
Would you stop that?
God, yes.
Autoimmune diseases can make antibodies go haywire, but still...
It's happened. Apparently, it's happened again. I finally have a case of lupus.
Thank you for watching this video. If you have found it interesting, consider liking, sharing, and subscribing. Please do post any comments, questions, or suggestions you have below.